Have you ever wondered how long most men last in bed? Okay, thank you. Welcome here again. I go by the name Ask Dr. Brown, and I'm here all day to give you all information regarding to urology, reproductive health, and anything that you want to know in this channel. You just find it here. So we'll start with the basics of what we normally know. What we normally know is that during the stimulation of sex, what normally happens is that a man reaches a certain level of sexual excitement. At this level, there's what we call the nervous stimulations that send the nerve information from the penis to the brain. And what happens or what is responsible here is what we call the dorsal nerve of the penis, which sends the impulses or the information to the spinal ejaculatory center in the spinal cord, which triggers ejaculatory reflex to take place. And I want you to note this, that during an ejaculation reflex, you cannot stop an ejaculation reflex. It's an involuntary reflex that cannot be stopped. When someone feels like ejaculating, it has to come. So that's what normally happens. That's the basis of the excitement and how now sex begins. And in this study, we define sex to be uh, just the penetrative one, leave alone the foreplay and everything. Here we say the penetrative one. We call it the intravaginal ejaculatory latency time. That's the vaginal penetration. And now, what normally happens is that the body sends signal to the bladder, neck, and the seminal vesicles to do what? To contract. And when the body sends these signals to the bladder, the neck of the bladder to contract, it means that you cannot pass urine during an ejaculation. So you cannot urinate at the same time when you're ejaculating. And what normally happens is that the seminal vesicles contract. These are glands that produce semen. They contract to release semen to the urethra. Again, what happens now for you to ejaculate? What happens is that the muscles around the urethra, we call them the corpus cavernosum muscles and the spongiosum muscles, they contract. And when they contract, what happens is that they now push the semen with sperms out. Now that's what we call the ejaculation. And this is by the help, also the support and maintaining of the posture of the penis is via the pelvic floor muscles. Now, the time of ejaculation depends on various things and it's different in individuals. A study that was done on 500 couples that were sexually active showed that for them they preferred, or I can say that the intravaginal ejaculatory latency time that was preferred among them was 5.4 to 5.7 minutes, and it was quite satisfactory. And this was monitored up to 4 weeks, and they had active sex for those all time. Again, what we have to understand is that how long do women want their men to last? It's stated that these women normally need 5.7 minutes, from 3 to 7 minutes. It's enough. 3 minutes to 7 minutes is enough. That's desirable. But many thought like 7 minutes to 13 minutes was more fun and more desirable. By now, this one does not have any limitations, and it depends on your partner and how you well know your partner. Another thing is that most women, they desire their sexual time to be 33 minutes to 37 minutes. This includes the foreplay. And for them, they desire the foreplay to last 14 minutes to 18 minutes before what we call the intravaginal penetration latency time. And remember, we say that in this study, we are defining this sex to be the penetration one, the vaginal penetration one. So we have men who couldn't reach the threshold and they felt insufficient. Now, this one we called it as a premature ejaculations. When we studied about these men with premature ejaculations, this is what we found out that it really has a significant impact and a bad impact to their psychological life. And what among these were they had embarrassment, they had low self-esteem, they had self-denial, they had a low confidence, and also they had that feeling of guilt. uh, but now this one shouldn't worry you, because we have alternative and we have treatments to these premature ejaculation, and the goal is to prolong your penetration time. So we have one like lidocaine spray. Lidocaine spray, it works by numbing your nerves. It prevents sensations, or it reduces sensations. And when it reduces sensations, the nerves they prolong, or they take time for them to send the messages to the required center for ejaculation. So and when we started about this lidocaine spray, a study done in America, it showed that in the United States, 500 men who used this one, they achieved 5 minutes more penetration than before. For example, if you had 5 minutes of penetration after using the spray, it could be up to 10 minutes, 11 minutes, 12 minutes. And also, this spray could be absorbed to the skin, so the spray wouldn't affect your partner, or maybe cause anything or any harm to the vaginal wall, or where it's getting the penetration to, because if you apply it 30 minutes before the intercourse, then it will be all be absorbed and you'll be free from it being on your topical skin. Again, how can we also do away with this? Is you manage your anxiety and you have self-confidence, and you remove away what we call performance anxiety. Basically, there's no amount of time that is precise, like how long should sex last, but it comes when you understand your spouse, understand your girlfriend, or you understand your partner on how you want it to be. Having sex a whole day, hours and hours, penetrative. Some it might be okay, but some it might not be okay, and that's not all the goal. The goal of having sex is for both partners to enjoy and have the desired feeling that they all wanted to have. So you should be able to understand your partner and don't be compromised, because we really don't have a time threshold that we say this is now the legit time. But if your partner is okay with your 3 minutes, then that's okay with you. If your partner is okay with 3 hours, then that's okay with you. It's for you to understand and ensure that the goal is both of you to feel good, and both of you to have the desired feeling that you wanted, and the goal why you were engaging in that activity. It's a good thing, and we will also learn that most couples with men with the premature ejaculate, they have problems, and they have uh, they're not stable in their relationships, because this is a factor that normally affects a lot of relationship. So it's good for you to come and sit down with your partner and discuss and know what is good for her, what is good for him. That's the best. Yeah, this has been my study today, and make sure that you comment and have your comment below. I'll check them, and if you have any question, I'll make sure I'll answer it in my next video. It has been your boy, Ask Dr. Brian, Mr. Bingo. Thank you for your time, and make sure you take care of yourself, because you matter the most. Bye. Make sure to subscribe, share, like, and comment. Must be a record.